Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. Brooklyn is in its first year of having its own School of Public Health at SUNY Downstate Medical Center. Downstate now offers a doctorate as well as a master's program. As public health is only going to become an increasingly crucial part of healthcare and healthcare reform, we wanted to introduce you to some of the school's leaders and its degree candidates and give you a taste of the type of research the students are undertaking as they prepare to take on the health issues facing the city and the nation.
So through your involvement in this research project, you'll be able to apply some of the concepts that we talked about in the basic environmental health class. And this is just one of the methods that we talked about in class to look at exposures, and we'll also be looking at internal dose levels. Do either of you have any questions about the project? I'm Dr. Laura GEER. I'm assistant professor in the Department of Environmental and Occupational Health Sciences in SUNY Downstate School of Public Health, and I teach in the MPH and doctoral programs here at SUNY, and I also am involved in many research activities. Well, I'll take you down and train you to recruit. We'll be working with pregnant women in the prenatal clinics, and we'll invite them to participate in the study.
We actually started as a Master of Public Health program in 2001. We took in our first students in 2002, a total of 12 students with 6 faculty, and we eventually expanded into a graduate program in public health, and we became a school in 2008.
Hello, my name is SAROJ. KUNNAKKAT. I'm a public health student, and I'm here to actually ask you a few questions related to mercury exposure.
So the research project that I'm currently involved with here at SUNY Downstate is assessing mercury levels in pregnant women in their newborns and examining possible environmental sources of exposure to mercury.
Have you been vaccinated for the flu during this pregnancy?
No.
No.
We're collaborating with the obstetrics and gynecology department here at Downstate. So we're recruiting through the prenatal clinics, and we bring women in their 7th to 9th month of pregnancy. We administer a questionnaire related to lifestyle factors or contributors to their environmental exposure to mercury, and we also take a urine sample from the pregnant mother.
So the first question is, do you eat fish?
Yes.
Okay. And how often would you say you eat fish? Like, would you say almost never, 1 to 3 times per month, 4 to 7 times per month, or several times?
Like 2 times per week.
2 times per week? Okay.
So we're interested in looking at mercury because, number one, this population is mainly immigrant. Approximately 70% are of island origin, for example, from the Caribbean. And also because there's been documented evidence that elemental mercury has been used for cultural, spiritual purposes.
And when was the last time you were at a dentist to have a filling filled?
Like 3 years ago.
3 years ago.
I think that it's very important to give the students an opportunity to work on some of these clinical research projects so that they can apply some of the skills that they've learned throughout the MPH program and to learn more about population health.
There are 3 major objectives of any school of public health, and they include teaching, service to the community, and service within the academic medical center, and research. Research informs the teaching aspect of any school, whether it be a college of medicine or a school of public health. So the research enables our students to have hands-on experience with looking into a specific problem, how to look at this problem, how to resolve it, and then how to translate that into a public health intervention that can prevent the occurrence of the disease that may be related to the causative agents that they're actually looking at. So they're all very much intertwined and connected together.
Okay, so how are we doing, ladies, with the recruitment of patients?
Very good.
We've done
very good
well
yeah.
so far.
I'm currently a Master's of Public Health student here at SUNY Downstate, and I'm in the Community Health Sciences track. I mean, my original intention for doing the public health degree was to actually gain a better perspective of medicine from the population perspective. I think, like, owing to Brooklyn's population being so diverse, I feel like this institution especially is very good at dealing with like so many of the cultural issues and social issues that play out in their patient population, because you're dealing with a wide variety of people from many different countries. I mean, I'm not an immigrant personally, but my parents are from India, so I can kind of relate to the issues that I know are in my community, and to like have tools to be able to intervene in a meaningful way is great.
Were you born in the United States?
No.
No.
Approximately 38% of the people of Brooklyn were born outside of the United States. So we're confronting a variety of diseases that are common to immigrant populations, urban populations, and there are great disparities in health care. Many of these diseases that people come to this hospital with are preventable. And so School of Public Health really addresses those kind of issues at the community level. As a result, we have had to link with a variety of community groups, and we have our faculty and our students working with these groups in order to get messages about health promotion, wellness, and health improvement out to the population.
Final few things that I have for you. The first are some educational pamphlets. These actually...
It's not that a person has to necessarily go into medicine to benefit from a public health degree. I mean, there's so many different career opportunities out there, and really so many ways to make a difference. So, I mean, a public health degree can really, come in handy regardless of whatever field you decide to go into.
So, let me get the materials ready, and then we'll be on our way.
Okay.
Brooklyn Independent Television on the BCAT TV network.